in 49 states, the patient doesn't own the record. It's not your record. And people always get frustrated with me. It's like, no, it's my record. It's about me. No. The creator of the record owns the record. And you didn't create the record. Even though it's about you, the record was created by the health system. The health system owns the record. The EHR provider doesn't own the record legally. And the patient doesn't own the record legally, except in the state of Vermont. It is not the law that you own the medical record. It is the health, it's the creator. Now, the question is, should we have joint custody? And I think that's the direction we should go. Sure, if the health system's going to create the record, they should own the record. I'm all for that. That makes sense to me. But I want joint custody. I want the ability to get access to the record so that I can start to engage other organizations on behalf of my health. If I want to use big tech, if I want to start signing up for Apple programs and something that Amazon does, and maybe I don't know, a Livongo or a Teladoc, and I'm going to start going out the normal channels that I do. I really want joint custody of my record so I can give it to the players that I choose to create as my health system ecosystem. Now, again, I just need to check here. Am I smoking something, or does that make sense?
No, I mean, I like it. The thing that you have to be careful of is, while patients can request to change their medical record, I don't think you want that carte blanche, right? To have a patient be able to update a record because it's theirs. It's both of ours. Only the health system can update it. Some people say, that's not right. It's my record. I want to update it. I might have said I'd take 8 drinks a day, but I really only want to put in there 3 drinks a day, or 1 or 0 or whatever it is, whatever it might be. And so I think it's okay to request a change. There is a format and a process for that. You have to be careful where that goes.
Yeah, and we created some tools for patients to give us information, and we always had metadata around that said patient-generated data,
right,
so that the clinician or administrative staff that was looking at it understood where it came from, and they would determine whether it needed to be verified or whether it needed, what level of credibility. By the way, we had metadata around provider created data, because some of our doctors said, look, if data is coming from that doctor, I don't trust it. I kid you not. I mean,
right, yeah.
And if you've been in healthcare long enough, you've heard those statements. And so they would say, look, we need to know if this is generated from within our health system or from a partner and so we create metadata around the actual data all the time that says, this is the source of this data, give it the credibility that you're going to give it.
Right.
So some called for informed consent on this article. Some actually called for a complete end to the electronic medical record altogether. Yeah. So, I love the discussion. I'll tell you, one of the things that's apparent to me is that Epic's clients defend Epic. They aren't seen as a corporation. They're seen as Judy. They're seen as a person. They care for them. Cerner is seen as a corporation. The two of them do the same exact thing, and one is seen as helpful and the other is seen as villainous. And that's just an observation on my point. I don't really want you to comment on it because I can get in trouble. I don't want you to get in trouble. But I'll tell you what, if people want to participate in the conversation, go ahead and follow me at Bill J. Russell on LinkedIn, and I'd love for you to participate.